I am Linda Marshall, and I am 71 years old. I think I was 50 when I first started yoga, and I loved it from the first time. It makes you feel wonderful. I also do water aerobics during the summer months and a chair exercise class. You move it or you lose it, and it's true. Exercise has been a part of my life for over 20 years until I got sick. I went to the urgent care facility because I figured I had bronchitis. I was coughing and I had a tightness in my chest. But the nurse practitioner told me that my heart was enlarged, that I needed to see a heart doctor. I ended up in the hospital where I was told recently I'd had a heart attack. I almost fainted when she told me that because I'd never had a heart problem.
One of the biggest problems of patients who experience a heart attack is actually scar formation. That scar can result in an aneurysm, enlargement of the heart, and the end result, unfortunately, is heart failure.
Over the next year, I started feeling worse and worse, and it reached the point where just walking from the kitchen to the back door to bring my dog out was like climbing Mount Everest. I couldn't do anything. I had no strength.
Some patients in this situation would be offered a transplant depending on age. In Linda's case, she was suggested of a left ventricular assist device, which unfortunately requires a battery pack.
I would never be able to get in a swimming pool again. I couldn't imagine that. The water aerobics has been such an important part of my life. I kept asking my doctor, what could we do? Because I kept getting worse. And he finally said, I had a leaking valve from my heart being stretched out of shape.
You can take a seat in here, and we're going to be with you very soon.
When she presented to us, thinking about trying to get her mitral valve fixed, we felt that it was the scar of her anterior wall that created the problem and not her valve itself. This whole area of scar, this is what makes your heart inefficient.
Dr. Fail said that there was a clinical trial that did not require open heart surgery.
The Revivant TC therapy is a markedly less invasive procedure for those patients who have anterior wall scar or aneurysm and have left ventricular dilatation and heart failure. These anchors are like buttons. We would take this is the dead tissue, and if we can tuck or basically remove that dead tissue from the activity of your heart, I think it'll help. As we take the anchors and we bring them together, we basically exclude the scar tissue from the heart itself, and therefore making the heart much more efficient.
It would make the heart function better to have this area of dead tissue that wasn't doing anything folded in and closed off.
As the geometry of the heart improves, the reason for the leaky valve also tends to go away.
I remember I was hugging the doctor and I was crying. No one had told me that I was dying, but I realized I had no future. This procedure gave me hope for the future.
Linda's procedure went very well. We were able to improve her pumping efficiency from approximately 25% to almost double right there on the table as we were finishing the procedure.
A few weeks after the procedure, I knew that things were better when you go from where you can't walk from your kitchen to the back door, and then you can go to the grocery store again. It was very dramatic.
It's really the first time that we've had a less invasive option for treating left ventricular dysfunction or scar. I'm incredibly excited about this procedure.
And a few months later, I started doing water aerobics again, and it was just really wonderful to be back in the pool. And then I was back to my favorite thing, yoga.
Take a wide step out.
We saw Linda in Followup at 1 year, and she's doing a lot of activities that I think she had thought were long since gone. Before the procedure, she had been in the hospital multiple times, literally at 1 month intervals. Since that procedure, she's not been back in the hospital once for heart failure.
My heart is pumping almost at a normal level, and I can tell a big difference.
And when you can see a patient walk through your clinic happy, comes back to you and says, I've returned back to my daily life, that's huge.
If anyone was considering this procedure, I would tell them jump at it, go for it. It's made a huge difference in the quality of my life. It's just been wonderful, absolutely wonderful.